Okay, so we can move on to the nose. We want to inspect, palpate the nose, make sure there's no abnormalities there. Test for nasal patency. I'll have you occlude one side and breathe in and out. And you do that on both sides. Then you can also, with the otoscope, take a peek in to see the internal structures, look at turbinates, the septum, and the mucosa for any abnormalities or obstructions there. Then we want to check the mouth and the pharynx out. So have you open your mouth. You're looking at gums, teeth, tongue, the oral mucosa, looking for any abnormalities. Have you stick your tongue out, good, and then say ah. We're looking at the uvula there. Checking for good symmetric rise and fall of that. That is cranial nerve 9. I would assess the gag reflex, which she's alert-oriented speaking. So obviously she has gag reflex. That's something you check on a unconscious patient. Then you want to test cranial nerve 12. So if you stick your tongue out and move it from side to side. Very good. Okay, so then we can move on to the neck. Inspect and palpate the neck. Check for any abnormalities there. Then we have to palpate some lymph nodes. So do preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and then supraclavicular. If you hunch your shoulders, you can palpate right above the clavicle there. Alright, then check the tracheal position. I'll have, just kind of want to make sure it's midline, nice and straight. And you can palpate that. Then we can move on to the musculoskeletal upper portion, upper extremities. You're going to stand behind your patient. Look for good posture, nice symmetric there. You can inspect and palpate that. Then we'll assess upper extremity range of motion and strength. So I'll have you put your arms up behind your head, put your arms out behind you, arms behind your back. Bring them up towards me. And you flex your elbows and flex. Good. I'll test for muscle strength. So try and move your arms away from you and then back into your body. Good. And then you can assess for elbow range of motion this time as well. Push out towards me, pull back. Good. And you want to look for wrist range of motion. Very good. And finger range of motion. Very good. And you can test for hand strength. Push towards me and pull back towards you. Alright, very good. Then we want to check pulses. Check radial pulse. That's 2+, and then a brachial pulse. And then you can look at the intratruncatal nodes there too. Palpate those. Then we can move on to the lungs and thorax. So we want to look at their rate of breathing, if they have any trouble there. So look at their work of breathing, the rate, the depth of breathing, any for symmetrical chest rise and fall. And then you can move around to the back. You're going to palpate the thorax in the back. Check for any abnormalities, and then kind of check for their respiration expansion. Good. Then you want to do a little percussion. And then you auscultate with the stethoscope, the diaphragm of the stethoscope. And you move from side to side. So take some good deep breaths for me. Good. couple more. Okay, very good. Then you come around to the front and you do the same. So we're inspecting, palpating the anterior portion. Percussing once again. And we'll listen. So I have my stethoscope. Deep breaths again. Alright, good. So you're listening for any abnormal breath sounds, any adventitious breath sounds there. Now we'll move on to the cardiac portion. We just want to look at carotid pulse, see if you notice anything there. You can look for apical, see if there's any bounding pulses or anything that you can just see by visualizing. Then we'll palpate, so we'll palpate the carotid. You're going to do this on both sides, but not at the same time, and you can palpate apical knee as well. Good. Okay. Then we'll take a listen. We can use our stethoscope again. You want to listen to the 4 valve regions, so we'll do aortic, pulmonic, tricuspid, and then mitral. Okay, good. So you're listening for like a murmur or any abnormalities there. You can do this while you're sitting, leaning forward, or lying on their side as well. Then you can do a breast and axillary, and that's something we won't do right now.